Aloha, I'm Dr. Taketa-Wong. Thank you for joining me. There are some very concerning side effects to many commonly prescribed pharmaceutical drugs that I want to talk to you about. I also want you to know that there are natural alternatives that are just as effective. But before we begin, I want to emphasize that people should not take themselves off any prescribed medication without first talking with their doctor. I can't even count the number of times that a patient has come to me, they're on a certain drug, and I talk about the potential side effects. I watch their eyes get wider. They listen and frown as they say, if someone had told me about the risks of this drug, I wouldn't have taken it. Nobody ever told me that. Yes, when we get a drug, there are inserts that list potential side effects. But honestly, how many of us actually take the time to read the very small print with hard to pronounce words? And that's not even the point. We're supposed to be told about all the risks and potential side effects before we're prescribed the drug in the first place. That doesn't mean we shouldn't take them. It means we should be informed beforehand so we know about the risks and can make an informed choice. Most of this really is a product of our healthcare system. Regular doctors typically are just not given enough time to talk with their patients. But a major principle of naturopathic medicine is education. It's one of its biggest strengths. Naturopathic doctors typically take the time to explain the medication or the procedure and ask if there are any questions. That said, let's get to the vitally important health information in today's event. And please be assured that there are natural medicines that don't come with all the side effects. First, we'll talk about oral birth control pills. Many of these drugs have the side effect of increasing the risk of blood clots, which can lead to increased risk for heart attack and stroke with prolonged use. Birth control pills can increase the risk of breast cancer by 20 to 30% over women who have never taken them. The risk does decrease once women stop taking them. Also, there is one class of oral birth control pills that does not increase the risk of blood clots or breast cancer and are also sometimes called mini pills. Basically, they don't contain estrogen, but they just contain the synthetic form of progesterone. Acid-blocking drugs for acid reflux. There is an increased risk of dementia with some of the drugs. Using them long-term, 6 months or more, can increase the risk of becoming deficient in vitamin B12 and iron because you need stomach acid to be able to absorb these nutrients. The most common symptom of iron deficiency is fatigue and being short of breath. I've also seen a decrease in attention and focus because iron carries oxygen. I want to mention that for now, we are still welcoming new patients, and to make sure our practice is the right choice for you, there is a no-charge phone consultation with me in advance of scheduling your initial appointment. This is so that I can talk with you personally about your health concerns. Our phone and other contact information is on our Facebook page. And please remember to visit our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. Our prices are very competitive, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Moving on to our next class of drugs, antibiotics. Antibiotics increase the risk of genital yeast and skin infections. They also commonly cause diarrhea, upset stomach, and even nausea and vomiting. They decrease the good bacteria along with the bad. Killing off the good guys can cause long-term problems with your gut and with your immune system. Also, Cipro and similar antibiotics increase the risk of tendon rupture. In fact, many doctors, including me, advise their patients not to exercise while on Cipro and similar antibiotics. There's also a greater risk of antibiotic resistance the more often you take them, which can make curing future infections more difficult. Antibiotics, as well as other types of drugs, affect the normal bacteria in our gut, the good bacteria, and they can actually change the neurotransmitters, which are brain chemicals. Among other things, a change in brain chemicals can affect our mood, focus, and attention. Epidurals during birth. Epidurals can increase the risk of seizures, infections, and nerve damage in the mother. Also, I've seen a number of women who have chronic back pain for the rest of their lives. They say it's that one spot where the needle was put in, where the epidural was put in. And for the baby, the risk is decreased oxygen and heart rate during the birth process. Pitocin during birth. Research has found definitely that using Pitocin to induce labor can increase the likelihood of needing a C-section. That's because it can force the birth process where the baby may not be in the best position to deliver. It can also increase the pain for the mom because it's forcing the uterus to contract in a much more intensive way than it would naturally. So Pitocin is what is used to induce labor in pregnant moms. There is also a possibility that the uterus could rupture, causing more blood loss. As to risk to the baby, there is potential fetal distress, where the baby isn't getting enough oxygen. It can also increase the risk of seizures in the infant after birth. So my recommendation is trying to avoid inducing labor unless it's absolutely medically necessary. Blood pressure drugs. Beta blockers are a class of drugs that frequently can cause fatigue, asthma, and difficulty sleeping. Diuretic blood pressure drugs can cause fatigue, leg cramps, and more frequent urination. And for some people, that can disrupt their sleep. ACE inhibitors like lisinopril commonly cause dry cough and skin rash. Calcium channel blockers can cause constipation, dizziness, and headache. Again, it's important to remember that it doesn't mean you shouldn't take these drugs, but knowing that there are natural alternatives is often very interesting and very reassuring for people. Cholesterol medication. Statin drugs, which are the main class of drugs that are used for cholesterol, deplete a substance called CoQ10, which is a major antioxidant that's important for your heart health. So using them puts people at risk for heart issues. Whenever I have patients that are on a statin drug, I always put them on CoQ10 in addition. Research has shown a link between statins and memory loss and difficulty with memory in general. Other side effects of statins include nausea, gas, constipation, and increased risk of diabetes. The most common side effect is muscle weakness and pain. Long term, they can cause muscle damage and harm to the liver as well. I trust our discussion about the very concerning side effects of commonly used drugs has been useful for you. Please remember that with these medications, especially with blood pressure drugs, it can be dangerous to just stop or take yourself off of them. Be sure to talk with your doctor before doing so. There are natural alternatives to many of these drugs that do not carry the side effects, and we've worked with many patients to be able to wean them off of their drugs. But again, you should avoid just stopping them on your own. With our no-charge consultation, you're welcome to talk with me personally about the drugs you're taking or any other health concerns so that you may too be empowered with your health. All of the contact information is on our Facebook page. If you purchase supplements, please visit our online supplement store, which is on our website at drtaketa-wong.com. Our prices are competitive with Amazon. You can trust the products, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Mahalo, and I look forward to seeing you in 2 weeks. Aloha.